Welcome back to Medical Coding with Blue. Today's episode is all about mistakes new medical coders are making on their resume. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So, in the last week or so, almost 2 weeks now, I've been getting messages from people talking about traditional resumes versus functional resumes. So, traditional resumes go in chronological order where you're listing all of your jobs and you're talking about all the duties that you had with that position. Functional resume is when you are listing and highlighting your skills and everything that you've done over your career. So the thing that I see a lot of new coders say, well, like this message I got here that I'm going to read here in a minute about having all of this experience and things from their past, and they want to put it on their resume as a functional resume. So that's what they want to do. That does not work when you're brand new in coding. Functional resumes are for people who have been in the industry that they're in, and they have the highlight reel because basically they've been doing the same thing, or they've been kind of working in the same sort of businesses and that kind of thing. And those types of things, those types of folks are the ones that need to have a functional resume, because that makes more sense. Because again, if you're doing the same type of industry, you want to highlight those skills. But you coming in brand new as a new coder with no experience in medical sometimes, and sometimes you do come in, you want to highlight your transferable skills because you don't have anything yet, or you have very little knowledge so far. So traditional is the way to go. And I'm going to tell y'all this too. 10 to 15 years back is all you need to write on your resume when you're a brand new coder. No more than 15 years. 10 years is okay. No more than 15, all right? Because if you go too far back, you're going to date yourself. Your resume is going to be the first thing that the employer sees of you when they're going through these resumes. So it needs to be down to one page, okay? Don't argue with me. So a lot of people are trying to argue with me. Don't argue with me. I'm a professional resume writer. And I write resumes not just for the health information, medical coding, medical billing and coding field, but I have written them for a lot of other professions as well. So I know a thing or two about what I'm talking about. So again, when you're sending in your resume, it needs to be on one page. And this one page is going to give all of the details of your work history, right? No more than 15 years back. So that way the employer can get a good snapshot of who you are, because that's what it is. It's a snapshot of who you are. It needs to be that draw and that, okay, we want to meet this person because they have all of their skills listed. And when I talk about skills, I don't mean organized team player. If I see that on somebody's skills list, I'm immediately rejecting that resume, because your skills is supposed to be your hard skills. That's ICD-10-CM, CPT, HCPCS, medical terminology, anatomy, pathophysiology. These are all on the job listings, okay? But let me read this comment and then we're going to get into it. So here we go. So the viewer says, "Thank you for your frank discussion. It is much appreciated. I just started online school with AAPC for medical coding. I am a former radiology technologist with mammography and bone density certification. I still remember most of my training, but I have to go back through my medical terminology and anatomy and physiology, etc. Again, no problem. Some of that I haven't seen since college, a long time before. I have been having trouble finding work in my 50s, realizing I needed to update my skills. I still love the medical field and miss it. I just physically can't do it anymore. I'm going to have to redo my resume functionally, as I have a variety of old 90s management experience, including records, so I don't date myself. I love to learn and research, and I'm analytical, so I know this is where I would be a good fit." First of all, the person wants to talk about their managerial experience because they have records experience from way back when. This is not going to work, because that's obviously paper records. And from the 90s, it's paper records. We are in electronic health records. And while there are still paper records floating around, it's getting less and less and less every single time. So that experience is becoming more and more irrelevant. Okay? So what I would say is this: you're not going to do a functional resume. If you are somebody who has experience for way back in the day that you want to talk about, you're not going to do it. Because again, when they're looking at your resume and you start talking about all these things, they're thinking that you have current experience at that and that you are somebody who has had experience in the industry. So don't do that. You need to do a traditional resume where you're doing it in chronological order. You need to talk about the highlights of what you did in that position. I don't need you to tell me that you ran a QRS report, because I don't even know what the heck QRS means to you, right? I don't even understand what that means. But if it's that you were running a census report, that you were running, if you were doing something with billing, that you were running a deficiency report, that's something that can make sense to me when I'm looking at it. So you don't have to tell me the special title names of reports that you're running. You don't have to tell me the special software that you work with if it's not relevant to coding, okay? So that's something else that you got to understand. So again, you want to set yourself up for success. If you start talking about, hey, I was a manager and I did all of these things, and you're trying to apply as a coder, they already have a manager. They don't need another manager. They want somebody who's going to be a coder. So you need to show that you can be a follower when you're first starting in the industry. That may be a little bit weird to some of you, especially if you have been a leader your whole life and now you're really, changing lanes and pivoting different career fields now, and you have to start at the bottom again. That may be difficult for you. But at the same time, when you are starting brand new in something that is completely different from what you did before, there's going to be a lot more things that you're going to learn. Obviously, you're always going to carry over those leadership skills, but that's not something that you need to highlight on your resume when you're starting off brand new as a coder. Now, if you want to talk about the fact that you kept information secure and private from your employees, like if you were doing payroll, if you were assisting with payroll and you kept that information secure, that's a good thing to write down. That's what you would want to put on there, because again, keeping information safe from prying eyes is something that we do all the time. If you did any cash handling or any kind of money handling, that's also something that you can write as a transferable skill. But don't ever sit here and say, oh, I was a supervisor and I did this and I did that. Not unless you are trying to be a supervisor. But again, if you're a brand new coder, that's not the job that you're going to be applying for, right? So just keep those things in mind. Yes, you may have had a manager title, but you only want to highlight the things that would be like, okay, that's kind of related to coding. That's kind of related to the industry, keeping information safe. If you're doing inventory, that is also about paying attention to serial numbers and being able to alphabetize and organize records and things like that. That's something that is a transferable skill, okay? I don't want to see brand new coders running around with functional resumes, because I don't know, again, where this is all coming from. But I don't know if there's something out there on the internet. But it's just like a couple of years ago when I was getting 100,000 emails about people asking for, do all coders get carpal tunnel? No. I know a lot of coders that don't have carpal tunnel, but you can know somebody who is a cashier who has carpal tunnel. So some fool was out there saying that and scaring people, and they were coming to my channel and asking me about it. I don't want to go through that again. Please don't make me go through that again. And please don't make me go through this functional versus traditional resume again. I have done plenty of videos talking about tips, okay? This is yet another one where I'm talking about tips to have on your resume. When you have your name on your resume, your name needs to have your credential on it. And the credential needs to be designated and on there appropriately. If you are a CPCA, I've heard people try to do this. If you are a CPCA, which means you have the Certified Professional Coder Apprentice credential. Now, the apprentice just means that you have less than 2 years of experience in coding, and that's all it means. People still get hired with it anyway. I don't want to hear this garbage about, oh, nobody wants to hire me because I'm a CPCA. I've written for plenty of CPCAs, and, never a guarantee, but they do get jobs. So it's just an excuse and it's a cop-out when I hear people say that, okay? Now, the other thing is this. If you have a CPCA, you need to put on there your name, comma, CPCA. Because this is immediately going to tell that employer, okay, this is an outpatient coder. This is somebody who is certified in outpatient coding, because that CPC or the CPCA, that is somebody who has shown proficiency on the CPT manual. Everything that's in the CPT manual, all those domains are listed on the AAPC website. And all of those things are covered on that exam. So if you pass that test, this tells me immediately that you are an outpatient coder. Now, again, if I'm a hiring manager and I'm looking at your name and you say your name, comma, CCA, well, I know that you have an entry-level certification in medical coding, but that you have one of the most toughest medical coding certifications to get. Because again, the CCA is not a Mickey Mouse exam. It is a very, very tough exam to pass. And for those that love to trash talk my CCA, those people could never probably pass the CCA, and that's the problem. I had the CCA for 13 years. That is a Certified Coding Associate, and that is the entry-level medical coding certification with the HEMA. The reason that it gets talked, there's so much trash talk about it, is because on the website it says the person has demonstrated entry-level competence in medical coding. Well, they think this is somebody that doesn't know anything. Obviously, if you look at the domains and you look at the pass-fail rates on that exam, you'll see that this is a very tough exam, because this says this person knows not just that outpatient coding in the CPT manual, but that they can also do inpatient coding. This is a coder that can be placed anywhere. And when I mean inpatient coding, I mean not just the professional fee side, okay? I mean that they can do ICD-10 PCS, that you're coding for the facility side, okay? Because that professional fee, that outpatient, that's all CPT coding, right? But when you get to that inpatient side where you're coding for the facility and ensuring that the facility gets paid, you're talking about the DRGs, you're talking about ICD-10 PCS, those types of things. That's also what the CCA can do. So not only can they do E&M, not only can they do CPT, not only can they do all those things, but they can also do ICD-10 PCS. Coming into the industry, that's great, because then that means you can go anywhere. You're not just limited to just outpatient jobs, outpatient coding jobs. Now, if you have this, let's just say, for instance, you went through a program and you like AAPC and you took the CPC and now you have the CPCA, but you also know how to code for ICD-10 PCS, it doesn't mean that you can't apply for inpatient coding positions. They're just going to look at you like, okay, but you're only certified for outpatient. Now, it doesn't mean that you can't code for inpatient. It's just that immediately what that employer is going to see when they look at your credentials is this is an outpatient coder. And until they start looking at your resume and seeing that you have that ICD-10 PCS knowledge and that the DRGs, MSDRGs, if you understand all that, then as long as it's outlined on that resume, then that's when you have the opportunity to apply for those. All the coders at my hospital, they all have the CPC credential. All of them. Because the story goes, when I first got here, none of the coders were certified. Not one of them. Okay, now I got here 15 years ago. Okay, but not one of these coders was certified. But well, by the time I got here, they were already certified 15 years ago. But like a year before that, none of them were certified. So the supervisor at the time was a wonderful lady, and she knew the people with AAPC, like the instructors and things that taught the programs. So she wanted to level up the coders. So she got everybody involved. And that's what I love. I love when I see leaders that get everybody involved and they want everybody to push themselves to learn more. And I love that. And she got everybody to, go through the course and take the test. Now, some of them had to take it a couple of times because they needed that second chance to be able to pass the test. And, a lot of them were able to do it. And so now they all have their credentials. Well, that included the inpatient coders, and so because they weren't quite ready at the time to take, the other ones that would be those inpatient coding credentials. So that's what they did. They got on the job training. And so that's the difference. So it's not impossible to get hired inpatient, but it really does help when you know what you're doing if you're applying for an inpatient coding position. I'm just saying. But again, that's why I say it's very important to have those credentials right on your name, because that's going to tell me right away, okay, I don't have to do an Easter egg hunt in this resume trying to find this person's credential. Okay, because that's going to irritate me, because you have seconds to look at these resumes. Okay, so it's got to be right, and it's got to be, okay, this is what it is. And then you have your professional objective, and that's going to tell them, what position do you want? Do you have to update this position every single time you send out this resume? Yes. No complaints, guys, no complaints, because if that ATS reader is looking at this, which they always do, the ATS reader is going to say, okay, it has these keywords that we're looking for from the job listing. Okay, so it's here, it's here, it's here. Okay, so we can go ahead and send this on. But if it starts to see that it doesn't have any of those things, it doesn't have any of those keywords like medical terminology, anatomy, pathophysiology, ICD-10-CM, and that kind of thing, if it doesn't have that, then it's going to be immediately rejected. So a lot of times when some of you are complaining that, well, my resume is getting, rejected immediately because I don't have experience. No, you don't have the right things on your resume for it to start recognizing. Okay, that's the problem there. And as I've said, if that's not the case, and you say, well, Blue, I have everything on there. I have it like you said, ICD-10-CM and CPT and HCPCS and all those good things, but it's still getting rejected. I have suggested that you mail in a printed version of your resume, and on that cover letter, tell them that you had applied through, electronically through their website as instructed, but that you wanted to follow up with a printed copy for them, because this has to go to somebody's desk because it came through the mail, and they have to look at it because they're going to open it up and look at it. So that's just another way of kind of thinking outside the box, because we want to get our resume in front of somebody, but we want that resume to look good. So again, one page. It doesn't matter if you were a nurse. I don't care that you know how to set up lines. I don't care that you are certified in BLS and all these other things. I don't care. What I need to know is, what transferable skills do you have? Again, one page. Just one. And if you had the same type of job, let's just say you worked at the Dollar General, and then you worked at the convenience store, and then you worked at Walmart, stocking shelves and things like that. You don't need to tell me the same things for every single place that you worked. You need to tell me different things for the places that you worked. Because if I'm looking at a resume and it's kind of got like the same types of jobs, like manual labor jobs, or just different versions of different places of these same jobs, like in retail or, in food service and that kind of thing. If I'm seeing the same thing, this is somebody who has no originality. It did not take the time to think about what they did at that job and how they can transfer some of these skills over, these transferable skills that they did. Because obviously you may be doing a lot of the similar things, but you're not going to always do the same thing over and over again. So think about that. And it doesn't have to be 50,000 things. It just needs to be right to the point. Okay? Don't repeat yourself in your bullet points either, because if you're doing that, you're wasting my time. If I'm a hiring manager, I'm looking at your resume. And yes, it may seem a little bit very blunt and a little bit harsh, but I think that a lot of times, because I had somebody on that had commented saying, well, we're not taught this in school. No, but you do have the power of the internet that you can do research. So this I'm the victim type mentality doesn't work. Okay? It does not work when there's access to so much good information out there. It's like, again, when I get messages from folks that are asking me, oh, Blue, I love your videos. I watch them all the time. But what books do you recommend? Do you think I respond to those? No. You're clearly wasting my time. One, you're either lying to me, telling me that you watch all my videos all the time when I always tell y'all all the things that I recommend are in the description box below, or you're just saying it just so that I can spoon feed you. Oh, yes, you get this book and that book. I don't need to do that. If you wanted to get into this field, you're going to do your research. Now, again, I have tons of videos. You can just go and watch all of these videos all day long because I've talked about almost every single subject under the sun. Every single subject under the sun. And I've got a lot on here, over 1,300 videos now, I think. So everything that you ever wanted to know about resume writing, tips for the interview and things like that. And people have told me that my tips have worked for them. So if you take a little bit of time and do the research and don't ask me simple questions because I'm not going to answer them. I'm not obligated to answer every single person. This platform being on YouTube is very wonderful because I get to share my message. But at the same time, I don't allow myself to get taken advantage of with my time. Okay, because I got a lot of other things that I have to do. And not only that, I have clients that I have to take care of. You know, because I do write resumes, I do professional coaching and tutoring and that kind of thing. So those folks are going to get my time because they're paying for my expertise, and that's what I do. But again, helping yourself by all these videos that I have and all the tips that I am sharing. It's not so that, you know, you can be discouraged. Because I get people who say that too. I feel so discouraged. Why? When I'm telling you the truth and I'm giving you a solution, right? I'm just being honest, you know? So again, if you're brand new, don't write yourself a functional resume because that's not going to work. That doesn't make sense. Don't write a functional resume and don't write professional summary because again, you don't have a summary. When you have experience, then you'll have a summary. When you have experience, then you'll have a functional resume. But until then, you're going to do things traditionally. And your cover letter, yes, you do need a cover letter. I don't want to hear this garbage of, oh, I heard you don't need a cover letter. You do. Why? Because the cover letter is going to be that conversation piece. That's where you're going to share your soft skills. That's when you can talk about being organized and a team player and all those other buzzwords that you think people want to hear. If that's not you, don't talk about that. And don't make your cover letter a regurgitation of your resume, because they're going to see the resume here in a minute. But the cover letter is going to be that human drawl. It's going to be, well, you know, I have this and I have this, and you know, if you have any gaps, that's a good time to explain those gaps. If you've been a stay-at-home parent, that is not a gap. Stay-at-home parent is not a gap. That is what you're going to put into your resume, is like you were home caregiver, you know, things like that. Because if you're taking care of kids, that's a full-time job. You're on call 24/7. There's no break from that. There's no break from being a parent. Okay? So that's the thing. That's a job. Because what are you doing as a parent? Some of you are doing homeschool, and that's obviously something that you can transfer over as well, because you're teaching your children. And, you know, maybe you were a Sunday school teacher too. And so you're able to teach people of different learning styles, different age groups and backgrounds and things like that. Don't you think that that's something that's transferable? Because you're going to be working with doctors who learn different. Okay. Every doctor learns differently. Some are more visual. Some are, you have to make lists, and they want very concise lists. They don't want all these extra words, you know. I was in a class one time when we were transitioning over to ICD 10. I was in this class, and we had this physician champion who came in. He's an awesome guy, by the way. And he was up there, and his specialty was urology. And so, of course, I'm surrounded by orthopedic surgeons. So they start, you know, bantering back and forth. But, you know, one of the things that he did was he had a very comprehensive 3-page little synopsis of everything that he was talking about. And he broke it all down with examples and keywords and things to look for and things like that. And so one of my surgeons came up to me after the class and was like, do you see this, Blue? Do you see this? I said, yeah, he did a really great job on it. He goes, I want it down to 1 page. I said, okay, you got it. No problem. So there's going to be some providers where you're going to have to train them differently. So that's the thing. If you already know how to do that, that's a transferable skill. If you worked with a PTA, again, that's your organization and teamwork skills, okay? You got to be able to work as a team when you're running these concession stands for the school, right? So there's all of those things. I don't want anybody to ever think, well, I wasn't doing anything. No, you were doing something. You weren't living this life of leisure. You were doing something, unless you technically were living a life of leisure, but then, or you traveling? Okay, if you were traveling, this means you know how to read a map. This means you know how to look at the rules for whatever area that you're in. You can follow regulations and that kind of thing. Guys, use your brain. Think about it. Think about all those things that you do. All right. If you're bilingual, that's something that needs to be on your resume as well. A lot of people leave that off. I don't know why y'all leave that off. You know, if you can speak Spanish, Spanish is one of the main ones that is very popular. Although there was a story that I have told before about a lady who wanted to get into the coding. And in order to get into the coding, they said, oh no, they were telling her no, kept telling her no. And I kept telling her, you got to make sure that you put on there that you're bilingual and that, you know how to speak all these other languages. The patient came in and I think they spoke Japanese. I think it was Japanese. Patients came into the billing department to pay their bill, but because they only spoke Japanese, it was very difficult for them. But one of the other people that was in the billing office was like, oh, such and such, they want to get into coding, but they speak Japanese. So they called her and she did the translation. Well, then guess what? They were able to pay their bill and, everything got settled and she got into coding. And it was good because she was able to, you never know, like what that organization, that healthcare organization or that doctor's office, you never know the population that they're serving. And in this case, it was really needed, but no one ever really thought about it until somebody had said it, that they know that that person spoke Japanese. So that's something that you guys have to think about. You have skills, you have training, and this is all very valuable and worth it. I'm just saying. So again, stay away from these functional resumes because they don't work for new coders. And professional summaries do not work for coders. It's professional objective. You're going to go the traditional route when you are making your resume. It needs to be in chronological order. You need to have it on one page, okay? Even if you had a bunch of jobs, you need to look at those main jobs that you had. If you were only at a job for like 3 months, is that really necessary to put on your resume? Probably not. Anything less than 6 months, 8 months kind of raises an eyebrow. But if you moved or something and that was the case, sure, go ahead and put it down. But be prepared that you will be asked about that. I'm just saying. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all again. Bye.